Mention and interpret the test for assessing bleeding and clotting. What are the tests? Tests for assessing integrity of platelet function. That is, if platelet function is abnormal, we have bleeding disorder, right? So, test for assessing integrity of platelet function and test for assessing the clot formation. So, we have tests for both of these. For platelet function, we have bleeding time. If bleeding time is prolonged, we think of platelet disorders, okay? Platelet count we do. Maybe the platelet count is less. Then platelet function assays. That means we actually test for the addition and aggregation. So there is platelet addition assays. Okay, platelet addition assays. And then there is ristocytin induced platelet aggregation. Okay, platelet aggregation. So this can be done to assess the platelet function. Then for coagulation cascade, there is clotting time, assesses intrinsic pathway, and this is not preferred because this is not accurate. Then we have APTT, activated partial thromboplastin time, that is for assessing intrinsic pathway. Then we have prothrombin time, that is for assessing extrinsic pathway. So any abnormality in intrinsic pathway only, APTT will be prolonged. Any abnormality in extrinsic pathway only, PT will be prolonged. However, if there is any abnormality in the common pathway, that is from factor 10 onwards. In common pathway, we have 1, 2, 5th and 10th clotting factors. If there is abnormality in any of these, then both APTT and PT will be prolonged because common pathway is part of both. Okay, just we'll complete the list. What are the other? Then we have thrombin time. Okay, so thrombin time assesses the function of thrombin only. That is, if thrombin is added, then how much time it takes for conversion of fibrinogen to fibrin. Okay. Then we have specific factor assays. That means we can assess for particular factors. So suppose we are thinking of hemophilia, we can assess for the presence or absence of particular factor in case of hemophilia, say factor 8. Mixing studies. Okay. These mixing studies help us in detecting presence of inhibitors to clotting factors. Okay. So let us see all of these one by one. How this APTT is done? So what we do is we take out blood, we take out a sample of the blood and immediately we chelate calcium. Okay, so what we do is we add one chemical which removes all the calcium, right? So these chemicals are citrate or oxalate. Okay. Now once the calcium is removed, clotting pathway cannot be activated because calcium is required in so many steps in the clotting pathways. Now we activate only intrinsic pathway. How do we do that? So after removing all the calcium, now we are ready with lot of calcium and we also have one contact activator. Okay, so these chemicals are available. We add them together, lot of calcium and this contact activator and phospholipid, we add them together and with this there is activation of the intrinsic pathway. So immediately as we add these chemicals, we note the time, that how much time is required for clot formation. So this will give us APTT. Then we have prothrombin time. Prothrombin time, same process we do. Take out a blood sample, first chelate calcium, then activate only extrinsic pathway. Take the blood sample, okay, then be ready with calcium and thromboplastin, which is the tissue factor. So this is factor 3. Okay, factor 3 activates the extrinsic pathway. We have these chemicals and we add it in the blood sample and immediately we start the stopwatch to note the time for clot formation. And this prothrombin time is expressed as international normalized ratio. Okay. Yes, we have the time, but what happens when we determine the prothrombin time with a particular chemicals which are given by the laboratory, then these chemicals actually differ from laboratory to laboratory, right? So this laboratory provides us with a standard value that if you determine the prothrombin time with my thromboplastin, the tissue factor which I have given, then this is the normal prothrombin time, right? That is the standard. Now, with our sample, whatever prothrombin time we get, we determine the ratio with the lab prothrombin time, and that is known as international normalized ratio. Okay. So remember, PT will be prolonged in extrinsic pathway problems, APTT will be prolonged in intrinsic pathway problems, and both of them will be prolonged if there is a factor deficiency of common pathway. Okay. Thrombin time, Again, it is assessing only the thrombin function, that how much time it is taking for conversion of fibrinogen to fibrin. Specific factor assays we discussed. Let us see in detail what is mixing studies. In mixing studies, what we do is we take the blood sample of the patient, okay, blood sample of patient. We know that there is some clotting problem is there. Now what we do, we mix normal plasma, okay, mix normal plasma. Now this normal plasma will be having that clotting factor which is deficient, okay, so here that clotting factor is minus, here it is present. Now when we mix the normal plasma, if now we determine the PT or APTT, it will improve, it will become normal. Why it will become normal? Because we have mixed it with normal plasma which will have that particular factor, right? But there may be case that this is not improved, okay, that even after mixing the normal plasma, we still get abnormal PT or APTT. Why will that happen? That happens if there are inhibitors of clotting factors in the blood sample of patient, okay. So that is important, that presence of inhibitors in the patient's plasma may also lead to abnormal PT or APTT, and that inhibitors can be detected by mixing studies.